Monkeypox. Monkeypox is an infectious zoonotic viral disease caused by the monkeypox virus and belongs to the Orthopox virus family. The disease is called monkeypox because it was first identified in colonies of monkeys kept for research in 1958. It was only later detected in humans in 1970. Monkeypox virus is from the same family of viruses known to spread smallpox and cowpox. Monkeypox is spread when you come into contact with an animal or a person infected with the virus. It spreads from person to person through close physical and skin to skin contact during intimate situations like kissing, cuddling, or sex, especially through rash, sores, respiratory droplets, or oral and bodily fluids of an infected person. You can also get monkeypox by touching contaminated objects and surfaces that have been used by someone who is infectious. Monkeypox can spread to people when they come into physical contact with an infected animal. Animal hosts include rodents and primates. Eating undercooked meat of infected animals can contribute to catching this infection. Who is at risk of catching monkeypox? Anyone can develop and spread monkeypox after being exposed to the virus. In Africa, most cases are among children under 15 years old. Outside of Africa, the outbreak is happening mostly among gay, bisexual, and other men who have sex with men. So, men who have sex with men may currently be at higher risk of being exposed if they have close contact with someone who is infectious. Monkeypox can spread from animals to humans. Animal to human transmission occurs through broken skin, like from bites, scratches, or through direct contact with an infected animal's blood, sores, or bodily fluids. Those at higher risk for disease or complications include people who are pregnant, children, immunocompromised people, health workers, and people living in the same household are at higher risk. Monkeypox can cause a range of signs and symptoms. The symptoms are typically mild and most people recover within weeks. If you get infected with monkeypox, it usually takes between 5 to 21 days for the first symptoms to appear. Normally, someone infected with monkeypox first presents flu-like symptoms including fever, intense headache, shivering, body aches, back pain, fatigue, as well as swollen lymph nodes. Then, within a 1 to 3 days of getting a fever, a rash develops. The rash can look like pimples or blisters filled with fluid that appears mostly on the face, followed by hands, feet, mouth, genitals, and other parts of the body that could last around 2 to 4 weeks. These blisters eventually form scabs, which later fall off. However, some people may experience a rash or lesions first, followed by other symptoms. Some people may also only develop a rash. People remain infectious until all of the lesions have crusted over, the scabs fallen off, and a new layer of skin has formed underneath. The treatment for monkeypox generally involves symptom management. Most people recover without needing treatment within 2 to 4 weeks. While there is no specific treatment for monkeypox, antiviral medications and vaccines that are originally developed to protect against smallpox can help prevent and treat monkeypox infections. Jynneos is a vaccine indicated for prevention of smallpox and monkeypox disease in adults 18 years of age and older determined to be at high risk for infection. The Jynneos vaccine requires 2 doses 28 days apart. However, people who are vaccinated should continue to protect themselves from infection for a few weeks after vaccination by avoiding close, direct, or intimate contact with someone who has monkeypox. Prevention. Fortunately, monkeypox is usually mild and most people recover within a few weeks, but as the infection can spread through close contact and can get severe, it's essential to isolate if someone is suffering from it. And for others, make sure to avoid contact with bedding and other materials contaminated with the virus. Practice good hygiene by washing your hands with soap and water regularly or use an alcohol-based hand sanitizer. When near infected person, wear masks and disposable gloves. Don't wash soiled linen or laundry of infected persons with those of non-infected individuals. Disinfect items or surfaces that have been handled or touched by a person, and make sure to cook your food thoroughly before eating. Avoid crowds. Don't attend public events if you exhibit symptoms. Practice safe sex. Be aware of the symptoms of monkeypox if you are sexually active, especially if you have new sexual partners. And if your partner has monkeypox, avoid close physical contact, including sexual or intimate contact, until all sores have healed and a fresh layer of skin has formed. The risk of catching monkeypox from animals can be reduced by avoiding unprotected contact with wild animals such as rodents and primates. Health workers should follow infection prevention and control measures to protect themselves while caring for monkeypox patients. In some people, monkeypox can lead to medical complications and even death. Complications include skin infections, pneumonia, encephalitis, confusion, and eye problems. If you have been in close contact with someone who has monkeypox, monitor yourself closely for signs and symptoms for 21 days after the time you were last exposed. Or if you develop symptoms, remain isolated in the home and away from others and seek advice from a healthcare provider immediately. Your healthcare provider will advise you on whether you should isolate at home or in a health facility and what care you need. So, thanks for watching. Stay happy, stay healthy. Bye bye.